Okay, so we're going to talk about the uterus now. So let me get the blue pen here. So the uterus is made up of the body, the fundus, and the cervix. So remember, body and fundus. We heard those terms before with the stomach. So here's the body, okay, of the uterus, and then the fundus is the turn. The cervix is the superior edge of the uterus. I'm going to erase that because it's kind of messy. The cervix is associated with or next to, I guess it would be superior to the vagina. And then the vagina is basically the birth canal that ends in the vulva. The uterus is medial to the ovaries and the fallopian tubes. And here are the two ligaments again, suspending the ovaries and holding them in place. So that they, don't move around, but also holding them in place so that they stay located adjacent to the uterus. So the myometrium is that muscular layer. It's a muscular layer that contracts during childbirth. The uterus itself is within the pelvic cavity of the body, and it sits just behind and posterior, to the urinary bladder. The endometrium, which is these kind of hot pink lines here, is the tissue that thickens and changes over a woman's monthly cycle, and it's the portion that's lost during menstruation. After 45 to 50 years, many women, all women who've been menstruating undergo a process called menopause, and this is basically where menstrual cycles cease. Menopause is defined as menopause if a woman has not had a menstrual cycle in 1 year. Now, when the ovaries are removed, that's, remember, called an ovarectomy. When the uterus is removed, we call that a hysterectomy. And sometimes the uterus may be removed for a number of reasons, one of which the uterus may be injured, the uterus may have been damaged during birth sometimes. So removal of the uterus, doctors try not to do that unless there's a disease process occurring or there's damage to the uterus. Now, the vagina, as I mentioned, is also called the birth canal. And the birth canal, this region here, is what connects the uterus to the outer world. It's located between the urinary bladder and the rectum. So the rectum is posterior to the vagina. It's about 10 centimeters long. Oh my goodness. And it's the region that receives the penis during sexual intercourse for fertilization to occur. So now let's talk a little bit about some of the accessory and supporting sex glands. The one that I never knew about until I took human anatomy were the Bartholin's or greater vestibular glands. The Bartholin's glands exist lateral to the vaginal opening, and they have individual ducts, one associated with each gland, and they make basically mucus that allows lubrication to occur during birth or during intercourse, and the ducts open right into the labia minora, so the smaller labia. So these would be the labia majora out here, and these are the labia minora right here. All right. So basically this mucus helps maintain pH as well in the vaginal area and helps protect against infection, because bacteria get stuck in mucus. They can't travel up into the vagina, into the vaginal opening. And they also help again with lubrication for movement during intercourse. The breasts are also considered, believe it or not, accessory glands because the breasts are not necessary for the survival of the organism. They're located, of course, over, I guess you would say, anterior to the pectoral muscles on the thorax, the exterior of the thoracic region of the body. The size pretty much is determined by how much fat is deposited around the milk secreting tissue. So the yellow region here is going to be fat, and then the mammary glands are all this grainy looking tissue, and then the mammary glands are associated with mammary ducts that release milk through a larger cluster of ducts that exit through the nipple. Lactiferous ducts drain, like I said, at the nipple, and they're surrounded by, and we don't have it in this picture, by a pigmented areola. And basically, what's the purpose of that? It gives the baby a target to aim at so it knows where the food is. Now, babies can smell their mother's milk really, really well. Babies are good at identifying where their mother's milk is coming from. And so babies oftentimes will do what's called a rooting behavior, where they sniff when you put something close to their face, they'll start sniffing it because they're trying to figure out whether or not that's, basically where the food is. In addition to the lactiferous ducts, lymphatic drainage occurs in mammary tissue, and that's really important because basically the lymphatic drainage in this region allows water to be returned to the system. But on the downside, because there's a lot of I want to say lactiferous lymphatic drainage here. I mean, we don't really see it in this particular picture, but there is quite a bit of lymphatic drainage that happens here. That can lead to the spread of breast cancer cells to another area of the body. So in this particular case, this is where lymphatic drainage can actually cause a problem, or at least the direction does. Oh, I'm trying to go to the next slide and it's fighting me here. So in addition to that, the external genitals, or usually the mons pubis, the clitoris, the orifice to the urethra, the Bartholin's glands, the vagina, the labia minora and majora, and the hymen are all included as external genitals and are all also accessory. The perineum is the area between the vaginal opening and the anus, and that's the region that a lot of times gets cut during birth, and that's called an episiotomy. So let's go back that's forward. Let's go back a slide. The reason why the perineum is cut is because the baby's head may sometimes be too large to exit the vaginal opening. And if the tissue tears between the vaginal opening, that perineum area, and the anal canal, that can cause a problem. And it's very difficult for doctors to stitch up and repair. So a clean cut off to the side will still allow the baby to be birthed, but the tearing of the perineum won't occur, which is pretty important because now if there's tearing, then there's potential for infection. All right, so let's talk briefly about the menstrual cycle. The menstrual cycle involves changes in so many parts of the reproductive system: the uterus, the ovaries, the vagina itself, and the breasts. It happens about every 28 days, but it can be as few as every 24 days, and it can go all the way out to 30 days in women. It varies depending on who you are, and it varies to some degree from month to month among individuals. And sometimes, oh no, there's the yawn. It varies within the same individual. So there are simple ways and more complex ways to break down the segments of the reproductive cycle. We have the follicular phase when you're looking at the ovarian cycle, the developing ovary and the follicle. Then you have the luteal phase after the ovaries released and the development of the corpus luteum. So these are all events in the ovary. Then you have events inside of, so let's draw a line here. This is the ovary. So that's meiosis, right? Then over here, you have what's happening in the uterus. So you have the endometrial cycle, what's happening in the endometrium. Then the functional layer. The functional layer is basically the thickness of the tissue, and it is associated with endometrial changes, but how thick the tissue gets over the reproductive phase. And then you have the zone of basalis, which doesn't change at all. You'll also see changes in human body temperature, female body temperature. As ovulation occurs, body temperature goes up. Don't worry about why right now. So during the endometrial cycle, the menstrual phase is when the endometrium is being shed and bleeding occurs. After bleeding ends, all right, so we call that 0. So when menses starts, when somebody's period starts, that's day 0. By day 4, the endometrium should be mostly sloughed off, and you'll start seeing an early proliferation of the tissues of the endometrium itself, so that it starts getting thicker and thicker and thicker. There's advanced proliferation, and then you end up, so that's proliferative phase, menstrual phase, proliferative phase, and now you have the secretory phase, where you have early, middle, and late secretion of hormones supporting the thickness of the endometrium. Now remember, what does the corpus luteum make? Progesterone. What did the follicles make? Estrogen. So estrogen that's being produced during the early ovarian or follicular phase here is supporting the development of the endometrium. So this is estrogen. And the maintenance of the endometrium is because of progesterone. If fertilization doesn't occur, then the menstrual phase will be initiated at about day 28, we'll just say, and the individual will start shedding the endometrial layer again. So, I mean, it's not hard, but there are a lot of steps that happen here, and it is very important to remember what hormones are important in each phase, the proliferative and secretory phase. What's happening during the menstrual phase? Estrogen is starting to kick in again. So there's a little bit of estrogen kicking in there. So this is just a series of slides talking about what each phase is. Menses, from the first 4 or 5 days. Proliferative phase, how long it lasts. Varies in lengths. The shorter the cycle, the shorter the proliferative phase. So this proliferative phase, if somebody has, let's say, a 24-day cycle, this is going to be shorter. It extends, it's characterized by repair and growth of the endometrium. The secretory phase is where the progesterone is supporting and maintaining the nice thick endometrium. There are other hormones at play, follicle stimulating hormone and luteinizing hormone, that causes the ovulation effect and triggers a decrease in the estrogen because the Graafian follicle is now burst and the Graafian follicle is transitioning into the corpus luteum. Oops, sorry. What are some disorders of the female reproductive system? Well, there are a lot of hormonal issues that can happen that affect the menstrual cycle. So menstrual cramps basically means very painful menstruation. So what's happening during menstrual cramps, I'm going to go back a couple slides, just so everybody is aware, what menstrual cramps are the contractions of the uterus. It kind of mimics the birthing process. So menstrual cramps, as the uterus is starting to contract slightly, females feel kind of pressure and cramping. Heads up, ladies, no one's probably told you this before. The cramps that you have having a baby, the contractions, feel like really bad menstrual cramps. So contractions in birth feel like menstrual cramps. Yeah, just letting you know early. Hope your parents don't get mad that I told you that. Anyways, and amenorrhea, this is the absence of normal menstruation. That can happen as a consequence of a few things. One could be not eating enough, having a very low body weight or low body fat percentage. The body will stop menstruating if somebody has a low body fat percentage. It can also be a consequence of hormonal disorders, and there are quite a few, so I'm not going to talk about them right now. There's dysfunctional uterine bleeding, or DUB. This is where there is abnormal bleeding that happens off and on throughout the month, and that is also a hormonal imbalance that occurs. And then premenstrual syndrome, which is a series of symptoms that occur in women, usually the week before menstruation, and sometimes up to 2 weeks. And what is happening? PMS usually hits right here at day 14, and it is because estrogen, so estrogen went up, estrogen crashes down here, okay? And let me make another color for progesterone. Progesterone starts going up here for maintaining that, okay? So that's progesterone. Progesterone actually interacts in the brain so that it inhibits a pathway and kind of makes you crabby. Let's put it that way. It kind of interferes with serotonin. Estrogen makes you feel happy. Estrogen gives you a good serotonin feeling. So when you lose estrogen, you're losing some serotonin in the brain. There's a lot of biochemistry in this. This is just the upshot. But it's the transition here and the drop of estrogen and the rise of progesterone that triggers the odd feelings or the anxiety feelings of PMS. So PMS is a real thing. It is driven by hormonal changes that happen in a woman during the menstrual cycle. And usually what happens is as progesterone starts going down and estrogen starts going up again on a natural cycle, a woman's mood becomes restored again. So sometimes for some women, PMS can last half the month, and that's really debilitating. So be aware that that's something that can happen in some women. We'll finish this lecture in just a couple minutes.